In this video, I want to talk about why your back might be feeling locked, what's causing it to feel locked, and ultimately how you can be identifying but getting rid of that lock sensation so that you can crack on with your health and well-being goals. So let's dive into the content. Thanks for checking out this channel. If you don't know me, my name's John, head therapist at John W Sports Injury. Here at this channel, we want to be doing three simple things for you. We want to help you to understand your body so that you can get rid of any pain or weaknesses and you can strive forward to hit your health and well-being goals. And as I mentioned, nothing is going to stop us more from hitting our health and well-being goals than having what we feel to have a locked back. Now, there's two main reasons why that back can feel locked. And this is something that's said a lot to me in clinic. You know, I have this lock sensation and I just feel like I want to have my back clicked. So why is that happening? Well, we can have skeletal reasons for this happening and we can have muscular reasons for this happening. And those two things aren't really mutually exclusive. A lot of the time, one is leading to the other. And that's what I'm going to talk about in this video, and whether actually you should be clicking your back and stretching your back and strengthening your back, and what are the key things that you need to be doing. So firstly, if we talk about some of the skeletal reasons and understand some of the vertebrae, and there's probably some key joints that we need to understand about our back and why these joints might be feeling locked and we're getting that restriction in movement. Firstly, we have what we call our sacroiliac joint. Now, the spine is made up of different aspects of the vertebrae. We have our cervical at the top, the thoracic is the sort of upper back, lumbar is our lower spine, and then we have what's called our sacrum, the sort of really low bit of our back, where at the base of that is our coccyx. Now, into the sacrum comes our pelvic bones, or our ilium bones, and what we have is the point where the pelvic bone joins the sacrum, and we get this joint here called the sacroiliac joint. Now, if you feel in that kind of dimple of your back, you can feel that dimple in your back. If your pain or lock sensation is in around there, that's a good indicator that we might have an issue at this sacroiliac joint, because all of these joints, the spine's a clever thing in that it's made up by all these multiple joints, and when they all move in harmony, we can create lots of good movements. But it's not one joint. So for example, if we're moving our elbow joint, that's one joint moving through. Whereas with the spine, it's each small movement compounding to create these big movements. So if we get a restriction in one of these joints, we can typically feel that pain. So for example, if I look to stand up and I want some movement to happen at my spine and my sacrum and my pelvic bones to be moving a little bit to allow for that movement, if that's locked, I can get that discomfort in there. Now, what we've also got is our facet joints, and these are the joints at the back of the spine, which are forming each of these little joints. And again, what we can have in here, the lumbar spine takes a lot of pressure, does a lot of work, and we can get these joints to actually lock a little bit. So what do we do about that? Well, I'm sure you would have seen some spinal manipulations around. They're all over YouTube, getting this clicking sensation. And what's happening here? Well, essentially, spinal manipulation is something that is always going to be hotly debated. Should we do it? Should we not do it? Is it good? Is it harmful? Well, I think it has its place, but I'm going to dive through into some more detail around this later. But what we are looking to achieve, whether we agree or not, is freeing up those joints to bring about that movement. And what we want to do really is take the body into a position that we feel that restriction and then go a little bit further to release that joint. So how can you do that safely to yourself? Well, one of my favorite methods is if I'm looking to release my lower left-hand side of my back, if I lie flat on something like a bed or the floor, what I look to do is I bring up this left leg. Now, what I want to create is a rotational effect in that spine. So as I start to pull down my left leg, I start to rotate my lower spine in that direction. Now, what I want to do here is create a torsion, a rotational effect. So if I just let my body roll, I don't create that effect throughout my spine. But if I look the other way and I bring my hands the other way, or at least one hand, that keeps my upper back fixed while I then rotate. And what we might find, and what I like about this one, is you can really look to manipulate that knee joint, and as we look to work down, you might just get a release sensation. And people often say, I hear that click or I feel that click. So what is the click happening here? Well, the click really is an audible sound of air being released out of that joint. So is that a good thing? Potentially, yeah. Because what that manipulation of your back has allowed to do is free up whichever joint might have been restricted. And again, what's nice, now really what I need to emphasize here is that we're not doing what we term high velocity thrust. So when you're watching people, trained medical practitioners carry these out, you will see perhaps that they'll take somebody to that point of resistance and then they'll thrust in that area. So that would look a little bit more like you would have that rotation and then a dramatic push down, a sudden high velocity thrust where they might typically say to somebody, inhale deeply, then as we exhale, bang, that thrust happens. What we're looking to do and what you can safely do with this stretch, if you get that rotation happening, and their mind just went there. I just felt that release and instantly that feels quite nice. So that's a good thing, right? Well, it is a good thing, but as I said, this lock sensation, and in my mind, really comes about because of two components. One being the skeletal, but two being the muscular. Now, again, if we come back to some of our anatomy, we've got key muscles at play here. One in particular is our QL muscle, and again I talk about this muscle lots on our YouTube channel, so I will link at the end of this video to some other information around specific muscles and how they're acting on the back. But that's a square muscle that lives on top of the pelvis, runs to the bottom rib and actually attaches onto each of those vertebrae. So if we develop some tightness in that area or some soreness in that area where they're actually acting upon the vertebrae, that can cause that locking sensation or that feeling that we can't get the movement out. Likewise, our glutes. I spoke about this sacroiliac joint, the pelvic joint in the sacrum. That joint is held in place. It's actually held in place by the glute muscles wrapping around it. That's what control that joint. So if we get this dysfunction in that area, that can create like a clamping effect. So that's another way where we want to be releasing those glutes. We also, the forgotten one that you'll hear me talk about on this channel is our hip flexors, which actually live at the front. So why are muscles at the front causing problems at the back? Well, they cross through and they actually attach onto these lumbar vertebrae again. So tight hip flexors brought about by sitting or running or jumping, what that can lead to again is this tightness on those lumbar vertebrae, which can lead to them locking. So what can you be doing about that? How can you identify perhaps which of these muscles are tight? Well, again, hang around to the end of the video because I'm going to link to a video where I talk about the 3 key muscles and how they affect the back. But what we can look to do to identify is start to assess our hip flexors. So if we kick off with the hip flexors, because we can easily get into QL. So if I get into this position here and I start to drive forwards and lift my chest back, I can feel a pull in that hip flexor area there. That's what you're looking for. Compare that left to right. Does it feel easier to move into one movement? Does it feel less painful to move into one movement? That might be telling us that there's a tightness on that left-hand side. From that position, we can also check out our QLs. So with my right knee down, I fix that pelvis. Remember, the QL muscle starts from the base of the pelvis, top of the pelvis, and runs to the base of our rib cage. So what I now look to do is pull my rib cage away, and I start to feel that muscle be stretched along with some other muscles. But if you find that creates a sharp pain in that lower back, that's an indicator that there could be a QL dysfunction. And remember, compare that to right to left. The spinal manipulation that we did earlier is a nice way of checking out those glutes. Do you find that one leg goes happily one way, and then when we go the other way, we just can't seem to get that leg moving because the glutes kick in straight away and we get that pull? That's an indicator. Another way that we can check this is what I call a figure 4 test, where we place one foot onto the knee and we look to lift up. Here I'm stretching out my right glute, but I want this left leg to get to 90 degrees. Maybe I change over sides and it just doesn't go anywhere. That side kicks in straight away, an indicator that we've got a muscular problem. But as I said at the start of the video, what you want to understand is that these two things aren't mutually exclusive. You don't want to just fixate on the skeletal issues, and perhaps you don't even want to just fixate on the muscular issues, because one can certainly be causing the other. Now, if you have watched this video and some of this is resonating with you, some of this you think might be applicable to you, I would encourage you to get those things checked out. Everything that I'm saying here is some guidance, some indicators that can happen, but we know that truly understanding our pain, our weaknesses, and the things that we need to be doing requires that individual rehabilitation program. You need to know if these muscles are tight or if these muscles are weak. You need to know if these skeletal joints are locked, and that's something that needs to be corrected by a trained medical professional. So I hope this information has been helpful. I hope that if you are somebody who's suffering with that lock sensation, which is so common in the clinic, that we get people asking us all the time, I just feel like my back needs to be released and clicked. That's great. And I always say the same thing to the people I'm working with. They hop off the bed, they instantly feel great. The movements that we typically did at the start, they couldn't do, they can now do. They think that's brilliant, which it is, of course it is. That's how we want people to initially be buying into the rehabilitation, but that's not the long-term solution. That for me is the easy bit. What you then want to do is truly understand what causes those restrictions or that locking sensation in the first place, so you can properly correct those things and you can strive forward and hit those health and well-being goals. Has that been helpful for you? If this has been helpful content, you can do me a huge favor by smashing that like button, because that shows YouTube that this is good content and others can be seeing it and you can help them free up their lower backs as well. And if you like my content and you haven't yet subscribed, then why not hit that subscribe button? That will be hugely helpful for me, but hopefully hugely helpful for you, because when you hit that bell notification, that means as soon as I drop the next video that will be coming shortly, you will be the first to know about it. And I mentioned that we've got another video that talks all about these muscles acting on the lower back. Here it is. So grab hold of that video and I'll see you on the next one.